excited today to have two guests from an amazing, innovative new practice called Rheumission. We love our plays on words. We have Dr. Micah and Dr. Bonnie. So how about I'll go first with Dr. Bonnie. Where do you live? What is your relationship to inflammatory arthritis?
I live in Los Angeles, and myself and my family have multiple autoimmune diseases. Some of them could be called inflammatory arthritis, and some of them could be classified as some of the other 100 types of autoimmune disease.
Awesome. I mean, awesome that not awesome that you have that and your family has that, but awesome that you're going to share with us how you've used that patient experience to make some really innovative solutions for other autoimmune and inflammatory arthritis patients. So I'm excited. Okay, what about Dr. Micah?
Yeah, so I am a rheumatologist. I live in Southern California also, not too close to Bonnie, but maybe an hour away. And my relationship with arthritis is that I have gout and spondyloarthritis um, for over a decade now.
Yeah, and I would love to know a little bit more about both of your backgrounds in, professionally and then what does into how did you get led to integrative rheumatology? What does that mean to you? How about Bonnie, Dr. Bonnie, you go first.
Sure. I actually started as a practicing clinical dentist, but as fate would have it, much as I loved treating patients, I broke my right wrist, which turned out to be a permanent injury and the very sad and unexpected ending of my first career. At that time, I had 4 kids, and I had to sort of get my act together. I went to a career counselor, all you career changers. They told me I was good at numbers and people, which was hardly profound. But I took the opportunity to go to business school. I have an MBA in finance, and I subsequently worked all over Wall Street, which is a really tough job. I was a sell-side equity research analyst, buy-side long-short hedge fund analyst. I did investor relations and communications, and all of this with limited use of my right hand and arm. In business school, I was actually technically a disabled student where I learned voice technology. So for all you listeners out there who can't hold things and have trouble with their hands, this is an ex-dentist who has somewhat recovered, but not totally in terms of my arm, my hand, and my neck. That's outside of my autoimmune diseases. And then I became a de facto autoimmune patient advocate for myself, my family, my son-in-laws, and my 10 grandchildren. And I was first a consultant, and then I was looking for a company that would serve my needs and the needs of my family. And I waited and I waited and I put together my own teams until finally I said, there's no one that's going to do this but me. And I gathered my resources at the age of 68 years old with 10 grandchildren. And I went out to form this company. And the first thing I wanted to find was a rheumatologist who shared my belief in complete patient care, who shared my philosophies about putting together a care team. And I interviewed a lot of them, and they didn't even come close until I met Dr. Yu. And literally, I thought it was a sign from up above that this company was meant to be. Not only was he trained in conventional rheumatology, but he is trained in integrative lifestyle functional medicine. He has the largest toolkit of any rheumatologist I have ever met. And over the last year and a half, where we've worked together very, very closely, he is what I call a Chinese mensch.
I was like, oh, is that a Chinese? Oh man, okay, I get it.
Yeah.
I love it. I love it. I mean, first of all, though, Dr. Mike, I have to say, I already knew Dr. Yu, and so I'm like, yes, of course, this unicorn, because he also has the patient experience. But also, I've never met anyone with your mix of experience as well. Dr. Bonnie, because most people who want to, like, I'll say myself, I had this similar thing, origin story for forming Arthritis Life and forming my Rheum to Thrive support groups. Like, someone needs to do this, someone needs to do this. And then, like, the pandemic hit and I was like, I need a project. Let me do this. Like I guess that's me. But I don't have any financial background, and that's been really hard. Anyways, that's my story. Figuring for me out how to create a sustainable solution to the kind of complex problems that are in our healthcare system and that a lot of autoimmune patients face. So I'm fascinated by how you've kind of put together all of your patient and professional experiences. And I always do think of, as an occupational therapist, dentist. I always say like one of the hardest jobs to do if you have something like rheumatoid arthritis would be like massage therapist, dentist, surgeon. Like
I
that's
loved being a dentist. And in fact, right now at Rheumission, I talk to every single one of our incoming patients. And believe it or not, one of the many reasons I enjoy that is, first of all, it's a dream come true. But second of all, it reminds me of my dental practice.
yeah. Well, and I actually even have someone who refers to themselves as an integrative dentist, which I know it's not like there's not like a board certification for, dentists as far as I'm aware. But I had Dr. Victoria Sampson on to talk about like the
Mm,
oral microbiome. And so anyway, but sorry, I'm already derailing.
that's
This is
okay.
episode 127. I have a hard time sticking to my schedule. But how about Dr. Micah? You've already shared a little bit of your experience, but what does integrative, rheumatology mean to you? And how did you
Yeah.
get into it? Yeah.
Yeah. Before we dive into that, I want to talk about how Bonnie actually found me because it was
Oh yeah.
a very it was by luck, I think, because
Mm.
she messaged me on LinkedIn, and usually I get a lot of spam on LinkedIn. My profile wasn't even updated at the time. I didn't really use it, and so I saw a message, and I thought it was spam. So I was about to ignore her message on LinkedIn, but luckily I responded, and it was a real person, and then we got talking, and that's how we started working together. So very grateful for that LinkedIn message, and very grateful for working with Dr. Bonnie here, who's been very compassionate and such a great mentor in this space as well. And so let's talk about my story here, how I got involved with rheumatology and integrated rheumatology to begin with. Well, as you know, I'm a patient, um, got diagnosed very early on with gout at the age of 17, based off a high protein diet at that time, the Atkins diet. And then over time, my diagnosis did shift, and I got pain in many different joints. And eventually, got diagnosed with spondyloarthritis after seeing like 3 or 4 rheumatologists with no diagnosis for many years. And I got diagnosed during residency. And I was offered medications. Potentially, I was flaring about at least once a month. I was very stubborn. Doctors are the worst patients. We don't want to do anything.
I've
Uh,
heard that. Yeah.
yeah, I would limp to work. I would sit on a stool in my ICU rotations because I couldn't walk. So it was a very challenging time. And luckily, I did find lifestyle medicine. And I heard that diets could potentially work. I was very skeptical at that time because we get no training on nutrition at all
Mm,
during during residency or medical school. So I tried going on a plant-based diet. I think within 2 months, 3 months, my pain just went away. I thought that was very unusual. I was like, a month goes by, no pain. I would flare every month, sometimes every couple of weeks. 2 months go by, nothing, and then I end up going to get my labs done. My labs, inflammatory labs, actually went negative as well. So I was very shocked, but also very relieved at the same time. So that's when I got on this path of how does food affect our body and inflammation? What's the science behind this? How come I'm not being taught about this? So I started reading books. I started looking at scientific articles, and I realized that I can't work anywhere else. Like I have to open my own practice. There's no one that can do this. Just like Dr. Bonnie, there was no one that can form her other company. She has multiple things that she's done in the past. I had to do things with my own way as well. So I opened my own private practice where I did integrative rheumatology, and I still do. But then me and Dr. Bonnie have combined together to try to find ways to bring this out to the public in an insurance model so that patients can get access to this with a whole person care team. Because I'm currently doing this on my own private practice, but at Rheumission, we have so many different clinicians that can help with their own specialties. We have me as a rheumatologist, we have lifestyle medicine, and we have dietitian and mental health as well. So
Mhm.
it's something that is very, very special. And the public, I feel like they're demanding this. They're demanding a whole person care team where we can talk about diet, we can talk about medications, we can talk about supplements as
Yeah.
well. And how do we use this to help patients with their priorities, their culture, their beliefs, and not force things down patients and not telling them that your food will is the only way to fix this. Medications are evil. That's not true at all. As a
Yeah.
rheumatologist, I use medications. I balance it out with diet. Some patients they do really well, then that's great. Some patients they need it, then we'll still use it. So it's a fine line that it's a art between and a teamwork between the clinician and the patient as well. So that's my story on arthritis. It's been a very long one, many
Yeah.
decades.
No, it's beautiful, and it's really, to me as an occupational therapist living with rheumatoid arthritis, it's really congruent with my understanding as an occupational therapist, which is we are trained in all the lifestyle that's non-pharmaceutical. We're saying, okay, what's under your control in your daily habits, routines, activities, whether that's exercise, stress management. We're a little bit the jack of all trades, master of none to some to some degree, which but when I first started looking into lifestyle, I was like, wow, why is there no guidance for patients on this? And when I was diagnosed in 2003, there was this idea that there isn't any good evidence for lifestyle. But now, flash forward, the American College of Rheumatology in 2022 even put out their first ever integrative guideline for rheumatoid arthritis with a supplemental, 500-page PDF of all these different evidence-based, guidelines. The strongest one being exercise, followed by like Mediterranean diet. So anyway, sorry, I'm going on a tangent, but it's been for me just in my 20-year patient journey amazing to see. I'm halfway. I'm 42, and I got diagnosed 21 years ago at age 21. So I'm in this like perfect midpoint of my life living with this, but also like it's really really exciting to see that the general population and doctors are more receptive to a combination. So integrative care is not alternative care. It doesn't mean that you're not ever doing medications, right? Integrative means that you're integrating both of these potentially, or potentially if it's important to the patient, some patients will say, right, like it's a meaningful goal to me to try to reduce my medication. Can I up my lifestyle factors and variables? Do you ever have that be like a goal with your patients so that they can
Mhm.
titrate down? Yeah.
Yeah, yeah. We have patients who come in and say, my goal is to get off medications. I don't want to be on my medications. Oh, well, let's slow down here. Let's take it one thing at a time. Let's use all the lifestyle factors, integrative factors, therapeutics that we can use that's evidence-based to help you. And at the same time, let's take it step by step. Maybe you are your biologics every 2 weeks. Maybe you go every 3 weeks. Let's see how you do. Let's see if you flare, and if you do, then we're not ready for that yet. So our goal is to keep them in remission. And tapering off medications, it can be challenging, but it has been done before. Um,
Yeah.
And
so
one of my touch points, actually two of them that we're combining at Remission, is chronic pain and movement therapy. So I've been
Mm.
a fibromyalgia patient for over 3 decades, and one of my frustrations was I had to be the CEO of my own health and put together a program of what I call movement therapy. No one helped me. The physical therapists, some of them were helpful, some of them weren't, but it has things like gyrotonic and Feldenkrais and Tai Chi and Qigong and meditation. And so at Remission, we're trying to incorporate the things I've learned and other people have learned and the things
Mhm.
Dr. Yu and Mandala support in our exercise program for our patients who don't necessarily always think that, what do they call it? Lotion is motion, motion is
Motion
lotion.
is lotion.
And it's hard when you're depressed and or obese and your body hurts to understand that exercise may be one of your best things to do for yourself.
Yeah, and it's really the devil's in the details, right? Like a lot of patients who are hesitant about movement strategies or exercise, I try to break it down. Well, there's kind of these 3 to 4 pillars, right? You have strength training, you have cardiovascular exercise, you have stretching, and then like balance kind of goes in there, which is more important as you age. Balance is much more important. So I should really just say 4 of them all the time. But if I found the biggest bang for my buck on my fatigue and brain fog has been strength training, which really surprised me because I was doing strength training hoping that it would help with just overall feelings of robustness and supporting
Mhm.
obviously the joints through muscles. But I always assumed that the brain fog and fatigue benefits were from cardio because like getting the blood pumping to the brain. I would like literally imagine that. But I was doing cardio consistently and not doing a strength training until September of 2023. And then I started strength training and it was really noticeable. I was like, whoa, I'm thinking more clearly. And this is not to say that everyone should do what I did. It's that when you experiment with your own body, you kind of learn like, okay, someone else might have the opposite. They might say, wow, the strength training didn't really do anything for my fatigue and brain fog, but the cardio did, so having some guidance with that, though, I'm at the point where I'm obviously like an occupational therapist and a patient educator. And even so, I was going to say, I know how to do this on my own. But actually, I also did go to a personal trainer because I'm like, I know that I know what to do, but I'm not going to do it unless I put, some investment into it. And I have this thing on my schedule and I know that April is going to be waiting for me on Thursday. So I got to go see her, and so I love one thing I love about Rheumission, which by the way, when we say Rheumission, this is the name of their clinic. It's RHEUMISSION. So rheum, like rheumatic disease, mission. I love it. And rheumission. We want to get into remission, REMISSION for our diseases. But that's one of the most important things that stood out for me when I first learned about your programs is that it's a team. You're not just on your own.
Right, and we do have an exercise program. Our first partnership is with Andrea Wool of Autoimmune Strong, and
Oh
she,
yeah, I follow her. Yeah.
yes, she is very experienced with autoimmune patients, and so we are very proud to have this personalized approach for the chronic pain that is associated with many of our patients.
Yeah. Did you want to say something else, Dr. Yu, or are you just nodding?
Yeah, I would say exercise is often overlooked and it's so important. It's anti-inflammatory. And our program, we want patients, if they can't run, then they can walk. If they can't walk, then
Yep.
stretch. There's a little bit for everyone. Some patients can't even get out of bed, but our goal is to just get them to stand up. Um, so
Yeah.
and exercise is so important. And remission, we are focused on different factors here. There's different pillars we're focused on. So exercise is one of them. Nutrition is another one. Stress management, mind body medicine is so
Mm-hmm.
important, as you know, as an autoimmune patient. And also avoiding risky substances, smoking, alcohol
Oh
drinking
yeah.
that can sometimes cause more inflammation. As you know, just smoking has been strongly associated with rheumatoid arthritis as well. We know that in
Mhm.
literature. So there's multiple factors here to get patients better. And what's special about remission, that this is the first time that lifestyle medicine and rheumatology are working hand in hand under one umbrella, one clinic. So
Mhm.
generally, when you go see rheumatologists, they'll say, "Okay, go find your own dietitian, or go see a
Yep.
dietitian." And
Yep.
they're somewhere else, or even if they're in the same university, sometimes it's so hard to navigate a big system, and people get lost. Um,
Yeah, it's a rude awakening. Like I mean, it's very almost like parallel evolution a little bit to how I developed my Room to Thrive program. Cause it's like, I was so, I saw patients have to cobble together their own care teams and it's very stressful and it requires a lot of medical literacy and a
Yeah,
lot of
it does.
cognitive executive function, to have to, and the time and money. Like most people don't have that, right?
Well, if you have
mhm,
chronic pain and you're fatigued and depressed, it's going to be extraordinarily difficult to be
Mhm.
this assertive, aggressive CEO of your own health, which is what I had to become before we founded Remission.
Yeah. Yeah, and, you mentioned some pillars that you address at Remission: stress, nutrition, exercise, and then overall kind of healthy habits like smoking cessation, stuff like that. What about sleep? This is what I always
Yeah.
call the underrated lifestyle factor.
Yeah, I knew I was missing one. I was like, I was counting them. Oh yeah,
Oh no, I wasn't trying to be
sleep's
like,
one of
what
them.
about sleep? No, I meant like I
Yeah.
want to give you a chance to talk about sleep.
Yeah, so our lifestyle medicine team does focus on the sleep. And sleep is, as you know, when you don't get much sleep as a autoimmune patient, you feel worse in the morning. You might
Mhm.
flare more stiff. So sleep is a very important part of our program as well. So our lifestyle medicine team focuses on that, and we do have habits that we can help patients sleep better. If that doesn't work, then maybe our psych department can help with that, or supplements can potentially help with that also. We don't want to jump to medications right away for sleep. We
Right.
want to emphasize all the lifestyle, good sleeping habits to help with this.
Yeah, I always say that, like, the space, not I always say, sorry. I'm going to give credit. Dr. Afton Hassett introduced me to the acronym SPACE symptoms, like sleep, pain, affect, emotions, cognition, and energy, fatigue. And I kind of put exertion in there too, like exercise. They all interrelate to each other, right? That's
Hmm.
the great news. The great news is that, like, turning the dial up on one can improve all of them. The bad news is that when one of them is bad, it also affects the others, right? Or would you agree with
Mhm.
But
that? Yeah.
especially in rheumatoid arthritis, let's not forget the oral microbiome. So let's add in that you need to have a healthy mouth and, regular checkups with your dentist. And there are oral microbiome tests to see the
Oh yeah.
types and quality of saliva, because the studies show that a dysbiotic oral microbiome can be a predictor to
Yeah.
rheumatoid arthritis, as well as heart
Yeah.
disease and other things.
Mhm.
We should
Exactly.
really call this space symptoms space in, put N at the end, like nutrition or space in, but microbiome. That's such a good point. Yeah. I don't know how much the average dentist knows about the oral microbiome in relation to autoimmune disease. How do you recommend patients who are interested in, like, learning more about this? Do you recommend they ask their no dentist, or is there like a good website people can learn more about this?
They can ask their dentist,
Okay.
or there happens to be a few companies that do oral microbiome testing. One of them is called Bristle, like the brush,
Nice.
and they have
Okay.
Yeah.
some good educational material.
Right, and that's an emerging space right now is the oral microbiome and rheumatoid arthritis and all these oral microbiome companies. I mean, rheumatoid arthritis, we've known for many years that the P. gingivalis bacteria has been associated with rheumatoid arthritis.
Mhm.
So how do we help with that? I mean, going to the dentist, cleaning that out, making sure you floss, all those things are very important. But how do probiotics, how does that affect it? We don't know much about that at this time.
Yeah.
So those are things that we're working on remission. We're always looking up the most cutting edge evidence-based medicine to get ahead and help patients in many different aspects.
Yeah, it is really exciting to think that, like, there are, additional things, like, under our, again, to me it's all about, like, what can I control in my daily life, that small changes, I want to be the most efficient you can if you live with fatigue. So you're like, wow, if I just increase my oral hygiene and if that
Mhm.
has a big moves the needle, that's
Well, it
amazing.
can't hurt. Let's put it
Yes.
that way.
Yeah, and
That part we know.
even if it's not like massively influencing your disease, and inflammation, it's at least, you're more likely, especially for me, I've been on methotrexate plus biologics for 20 years. And, so there's the immunosuppression that you do experience with that. So you're more, if you have good oral hygiene, you can at least be less likely to develop like gum disease and some of those. So I'm very, very consistent. Like, I am actually militant about my dental care. I mean,
Your
I'm like
teeth
to
are
the
very
point.
white.
Yeah, yeah. No. um, and I was going to say back to, you're saying why is this team-based approach not done as commonly? The only place I've ever seen it done consistently is pediatrics. It seems like with pediatrics, they've kind of figured out, and in pediatric rheumatology, most people don't know, is like a completely, Dr. Yu, and Dr. Bonnie, that it's a different specialty. Like a adult rheumatologist can't just decide to see kids and vice versa. Like pediatric rheumatology, you're a pediatrician that then specializes in rheumatology. Whereas adult rheumatologist, it's internal medicine first, right? And then you do
Mhm,
the fellowship in rheumatology.
mhm.
Yeah. So these are different professionals treating different diseases, even though they're both have rheumatologists in the name. But in pediatric rheumatology, I have seen, at least as an occupational therapist, I know there's OTs that I've met through the Association of Rheumatology Professionals that they're like, oh yeah, I work in this multidisciplinary clinic, and like the patients get diagnosed and then they see the PT, the OT, they see a dietitian. But I've never seen that done in adult rheumatology, like in a very systematic way, especially addressing the mental health and the stress management along with it. Because who wouldn't be stressed? Like literally. I told my, sorry, this is maybe a little side note, but I told my own psychiatrist and psychologist, I'm like, okay, so if anxiety is like a too big reaction to like a fear that's out of proportion to the threat, like tell me if my body's attacking myself and I have a progressive autoimmune disease, like in your opinion, what's the appropriate amount of stress I should have? Because it's not zero. Like it's not adaptive for human beings to have zero stress about their body being like their health. Like I don't want to be the human that like died because they were like, there's a fire coming. Oh well, no stress, like
Well,
just
well said, Cheryl. And in doing research before I founded Rheumission, I was a digital health consultant for many of these companies. The anxiety and depression piece is well documented in the academic literature as accompanying autoimmune diseases, whether it's a chicken or the egg, whether it's the inflammation or not, whether it's just the shock of getting this long-term diagnosis that you're describing in very good detail. I would say most patients who have an autoimmune disease have some level of anxiety and depression. And when I talk to our incoming new patients and I say that, I can honestly say all of them say, yeah, that's me
yeah.
and me and you and
Mhm.
every probably almost everybody else.
Yeah. Yeah, and learning about that it helps normalize it, and it helps it seem like, it's not your own moral failing that you're stressed, saying, okay, yeah, we all experience, if you're having chronic health issues, especially pain, it's normal to be stressed. And it doesn't mean that your stress caused your condition. It just, but we can still do things to improve our quality of life. So, um, I also wanted to ask Dr. Bonnie, I read your LinkedIn profile. We're all hanging out on LinkedIn. No, I don't actually spend much time there. But you said, I thought this was interesting wording, and I would want to give you a chance to share more about this. You said the biotech and digital revolutions offer new tools that can speed research, create new diagnostics and treatments, and support patient-centered virtual first care, V1C delivery. This is just, I'm literally just wanting to learn more. Like what do you think what are some of these new revolutions, and why is virtual first care like important in your mind?
Well, the first is telemedicine was normalized during COVID, and
Yes.
Dr. Yu himself has been doing telemedicine longer than that. And in his practice, without even talking about new tools and technology, he's found remarkable results and getting patients to remission. And at our Rheumission, we are now looking at new tools. And what would those tools look like? One could be an oral microbiome test, or maybe we're going to look at gut microbiome. We don't know. One is screening blood tests, but I'm going to let Dr. Yu tell us about the other new technologies that we're kind of thinking about. They're at the intersection of AI, digital
Oh,
health, virtual first. Biotech has a few, there's drugs in the pipeline for sure. And I'm not sure what's going to happen in our biotech world to be exact. Dr. Yu, can you add some?
Yeah. So, I mean, oral microbiome tests, Bonnie mentioned already, gut microbiome tests. How valid is it? There's so many companies that do this. And also there's emerging devices in the literature that can help with autoimmune diseases.
mm,
Also, we, what else is there? So we talk about the oral microbiome, the gut microbiome devices, and also I'm trying to think here. I think those are the main things. Oh, also, there is a test for rheumatoid arthritis that can tell whether a patient is resistant to a certain biologic as well, PRISM RA.
yes.
So there are some cutting edge tests out there.
And
And what
and
would,
we
What
Oh,
we're
sorry.
looking for is new tests that will help predict flares, to be exact.
Yes, yeah, and I think what I was thinking about, that you might have been, like, referring to as maybe like precision medicine as well, like giving the right treatment to the right patient at the right time, which historically it's been a little bit of like throwing darts at a dartboard, like a slightly informed version. Maybe you have like an area of the dartboard that you're kind of target a quadrant, but you want to make it really specific, right?
Yeah, there's so many things out there, and also looking at the environment, how do the
Mm.
pollution, smoking, toxins, BPA, VOCs, all these. There's more and more evidence in the literature. How does that affect the body? So those are all things that we can look forward to in the future that we can possibly use to the advantage of rheumatology. And we don't forget genomics testing and genetic testing as well. That's something that's up and coming emerging.
Yeah, I was talking to Benaroya Research Institute
Hmm.
researchers, and that's just in my backyard here in Seattle. I've donated my own blood to their biorepository for testing. I keep meaning to get my siblings and my parents to as well, because they're looking into that family hereditary, pattern and trying to figure out, why did the RA predisposition, why did it turn on in me and not my siblings? You know what I mean?
Exactly. And the bigger picture, in my view, of why I founded Rheumission, as we were talking about, Cheryl, is for my 10 grandchildren, some of whom have a double dose of these genes. And the fundamental question, as their grandmother, is what are the lifestyle modifications for children that
Ah.
we might be able to prevent that switch from turning on? So, yes, I teach my grandchildren to meditate. I've introduced them to yoga. Uh,
Mm.
I try to talk about living in the moment and being happy to children. But we need more than that. And at Rheumission, we're going to stay cutting edge with new novel things that we're looking at in order to at least begin to answer my fundamental questions of how to leave a legacy for the next generation that isn't better than our current tools.
That's absolutely beautiful. I mean, and I couldn't really agree more. I mean, I only have one child, but I do think about, him having he has a 1% chance or 2% chance of developing RA from what I understand. It's like 1% typically, and then since he has a parent with RA, it's twice as likely, which only brings it up to 2%. But still, knowing that there's so many things that I want him to be set up for success, mental health wise, like you mentioned with meditation, mindfulness practices. It's kind of a win-win, right? Thinking even if you don't have an autoimmune condition, but it's even more important when you do. So I think that's
Yeah.
that's a really truly amazing. Are you from New York originally? I'm sorry, I can't stop myself from asking that. Are you from
Me?
the East Coast?
Yes.
Okay, that's what I thought. I went to school at Vassar, and which is upstate New York, but I was like, I detect like the New York or
I'm from Hartford, Connecticut.
oh, from Connecticut. Okay, okay.
Yeah.
I love it. I love it. That's just me, just word vomiting. But back to the yeah, the formation of Rheumission. Is there anything else you two wanted to share about, the process, maybe how I do want I think people listening are probably like, oh, how do I sign up? It is only in California currently, right? Even if you're telemedicine, you have to be a resident in California. Is that right?
Correct. We're only in the state of California. We're expanding potentially to Pennsylvania very, very soon. So maybe by the time this podcast gets released, we'll be in Pennsylvania. So to get the most up-to-date information on what states we're licensed to see patients in, just go to the website. And our goal is to be a national provider. So our goal is to be in all 50 states.
Nice. It makes
And
sense to start in one, start it, get the proof of concept. I'm not giving you advice, Dr. Bonnie. You've done a lot more actual business than I have, but I was just thinking it makes sense. I mean, the whole country is huge, so
yeah, and signing up to be a patient is very simple. Just go on the website. There is a book now, and it'll take you through a form where you answer some questions, and then you can make it a visit with me pretty fast. We're available within a week, even a
that's
couple of days.
amazing.
Hmm.
And then you end up getting like a personalized plan, and you have various, depending on your needs, different professionals that you check in with, right? Whether it's a
Right.
nutrition. Yeah.
Right. So they'll see me or another someone else from our rheumatology team, and then they're going to see the lifestyle medicine team and go through that whole person care process.
I love it. I love it. Is there anything you would add, Dr. Bonnie?
Yes, it's very personalized, customized, tailored. It's all the things I wish I had been able to find.
Yeah, yeah. I mean, I was going to ask, like, what were some of I mean, we could spend the whole episode talking probably about like horror stories of, the gaps in your own care that led you, or your family's care that led you to. But what do you think are some of the biggest things missing in the current standard of care? Like the kind of, I say, 1 20-minute appointment with a rheumatologist is not sufficient, no matter how amazing that rheumatologist is. 20, actually, people are like 20 minutes. I only get 10 minutes every 3 months. I'm like, whoa, I thought 20 minutes once every 3 months was egregiously small. They're
I
saying
would
they don't
say
even get 20.
it's more systemic than that. The current treatment for autoimmune disease is divided by body part. So, and if you have an undiagnosed one that doesn't fit into a conventional medicine bucket, that's chronic pain, maybe it's mixed connective tissue, maybe it's lupus, maybe it's RA, maybe
Mm,
it's some Ehlers-Danlos, maybe it's fibromyalgia. The current system will send you from specialist to specialist. You'll see a dermatologist, an endocrinologist, a rheumatologist, a GI doc, et cetera, et cetera. Heavens help you if you end up in the anesthesia chronic pain category. Don't get me started on that one.
oh boy.
But the system needs to realize that the head is connected to the body and that we are one connected system. We should not have to see specialists by body parts. And the literature is now only beginning to understand that inflammation is a spectrum. They're linking all sorts of other diseases that may be part of this inflammatory spectrum. I'll let Dr. Yu give his expertise on that. So I'd say two things. Don't treat us by body part. Don't send us to a million specialists. And if we're undiagnosed, it's not in our head. It's merely in parts of our body you don't understand yet because of this inflammatory spectrum that is being redefined. Your turn.
Wow. No,
Yeah.
that was beautiful.
Mhm. I agree with Dr. Bonnie on all points here. A 20-minute, 10-minute visit isn't enough. At Rheumission, you actually get 1 hour in the initial visit, and then half an hour on follow-ups. And if you need more, we can also offer more as well. And currently, the gaps in rheumatology, number one is it's not enough time for a visit.
Yeah.
Number two is the time to see a rheumatologist is sometimes 6 months, 1 year. I've heard 1 year from some of my patients.
Yeah.
Up in
Yeah.
Canada, I heard 2 years from a patient as well who crossed the border just to see a doctor, a rheumatologist. So
Mm.
in remission, we can see you within 3 days, 1 week at the latest. So very quickly. And other gaps here are the rheumatologists, like Dr. Bonnie said. In rheumatology, traditionally, we see symptoms by specialists. We're in
Hmm.
remission, we try to gather it all together. Oh, you have a GI issue? Is that causing inflammation that's making your flares worse? How do we address that? What you have anxiety, depression?
Yeah.
Well, let's talk about that. Let's bring it all under one clinic. As a rheumatologist, in my training, I never talked about their mental health. I just approached the disease, gave them medication, and that's it. Now we're going to revolutionize this and say and ask them, what anxiety, depression, and what other symptoms do you have? We have a team dedicated to this that will talk to the rheumatologist, and we actually have meetings in the clinical team to bring up patients and how
Hmm.
to fix and get them better by a multidisciplinary approach. Because how often do you see a psychologist, psychiatrist talk to a rheumatologist? You never see that, even in a university system where they have all these specialties.
Yeah.
That never
No,
happens.
it really is only on the doctor's own time and dime, really. And I think, yeah, it really struck me when I was pregnant in 2013 to 14. And I was like, hi guys, I'm one body. Like, but I have another, like, I have some about like a baby in me, but like, I the like the OBGYN recommendations for my medications were opposite of the American College of Rheumatology recommendations, which were opposite somehow of the pediatric. And I was like, I'm not a doctor, so someone needs to help me look through this and be like, okay, is like, they'll say, you should take this medicine. I was on Remicade and Imuran, and they're like, you should, you shouldn't, you should, you should. Everyone was telling me something different. And I'm like,
Yeah.
I'm one thing. Like, like, what do I do? So that was just such a distinct example because you literally, and the stakes are so high when you're pregnant. So I know that there are, by the way, updated guidelines from the American College of Rheumatology for medications during pregnancy and reproductive health during family planning for both female and male people. So how it affects sperm and how different medications affect everything. So that came out in 2020. So people should know there's a lot better guidance now. Back then, though, only 10 years ago, it was quite stressful to try to figure it out on my own. So
Right.
yeah. Sorry, I just
Yeah.
had to jump in.
Yeah. And talking about guidelines, you mentioned earlier the rheumatology integrated medicine guidelines. Well, I would say that not all rheumatologists know those guidelines.
No.
Rheumatologists don't even know that was even released.
Yep.
So at Rheumission, what's beautiful about our clinic and our whole person care team is that we understand integrative medicine in and out. We understand how you supplement. When you go to a rheumatologist, you ask them about all these herbs and supplements. They don't know what that is. So at Rheumission, we're able to say, okay, this is what you're taking already when you're coming in. This is the evidence behind that. This is how it can potentially affect your condition or affect your other medications or other supplements. We know how to, I'm board certified in integrative medicine. Dr. Melissa Mandala, the lifestyle medicine doctor, she is in her fellowship for integrative medicine. So we know how to use those supplements in and out. And not only just for their autoimmune disease, but also for diabetes, high blood pressure. We know how to integrate the whole system together. That's what makes us beautiful.
No, I love it. And I have been facilitating, I call them educational support groups, like the Room to Thrive support groups. We spend part of the time, giving evidence-based tips and guidelines for the various lifestyle factors. And then the rest of the time facilitating like a support group. But I can't tell you how often the people in the group say, like, it's like, who's going to look at my whole body, not just my body, but the context of my life. Like Bonnie was saying, Dr. Bonnie, their head's connected to your body, and your body and head exists in a context, right? Like, and I mean, it's huge. I often will say, look, like people are like, oh, well, how, you did so well. Like when I was first diagnosed, I was on, or there's been periods in my life where I've done really well in my medication treatments and I've been able to do all this stuff. And I say, look, if I wasn't married to my husband who works for a rich tech company, I didn't have access to these medications through his insanely good insurance, like my whole life would be so different. Like before I was married, I worked 20 hours a week at a government job and then 24 hours a week at a nonprofit just so I could get health insurance, because the nonprofit didn't give health, that's like, and I also had socioeconomic privilege just coming into my diagnosis. My parents hired a designer, or they called it a designer doctor by then. Now it's called a concierge doctor, because I kept being told she's not sick. She's just anxious. She's just type A. It's all in her head. Go to psychiatry. Obviously I'm still salty about that 21 years later, because that was, that was by far the worst day of my life. People are like, oh, is it like the worst day of your life when you got diagnosed? No, that was like one of the best days of my life, because finally someone believed me. Like being medically gaslit was just, and I'm sorry I'm triggering anyone who's also been medically gaslit. It was a horrible experience. And so anyway, long story short, the context, socioeconomic, how much social and family support you have affects your function. As occupational therapists, we take that into account in our first evaluation. Sorry, not to like go on a thing about like how great occupational therapy is, but that's part of our job. Like, is knowing, what is your daily life like? How much support do you have? Like such simple questions, but often aren't asked, just like, oh, what's your blood work? Okay, well, that tells you like one tiny picked sliver of what's important,
That's why
Right.
we're eager and anxious to have more patients, demonstrate outcomes, bring this to as many people as possible.
Well, hopefully the podcast will help. We have a good little healthy listener base. I know we only have about 9 minutes left. Is there anything else you wanted to share with the audience before I go to the quote unquote rapid fire questions, which I might edit these down a little bit, but yeah.
Yeah, I do want to add one thing. Typically, when you see a rheumatologist, you go on a biologic, potentially, but then if that doesn't work, they just cycle through all the different biologics without addressing anything else. At Rheumission, we can potentially cycle through biologics, but we take a step back and we see what else is driving your inflammation. Why are you so resistant to these
Mm,
medications? To potentially, instead of cycling through 10 biologics, maybe they can stop at biologic number 3 and then work on everything else and then get their
yeah,
whole the chronic inflammation down, beyond just a biologic. So
yeah,
it does take a village. It takes a team to create this. It's a lot of work. We've been working on this for many months. We're so happy that we're finally seeing patients now. And every single patient we've seen so far has been so appreciative, saying, "This is what I've been looking for." I'm like,
yeah.
"Great. Well, can you spread the news to other patients?" Because patients when you're new, it takes a while for patients to find you. So we're very
Hmm.
thankful for this podcast, that you're reaching this population to help us get this message out.
Yes, and let me add, my official title at Rheumission is co-founder and chief patient officer. And as
Yes.
the chief patient officer, not only do I love to talk to the patients because it reminds me of my dental practice, but we are creating a new novel program from a business perspective. It's called the Patient First Strategy, and it has a foundation in patient research. I've done over 500
Mm,
patient interviews to really understand what patients want and need, and we continue to do more interviews. The second is we have a patient feedback program where we are asking patients how to iterate our product and how to improve it for the other autoimmune patients coming after them. And the third, that's considered a first of its kind new and novel idea, is called a patient advisory council, where we are having strategic advisors who have these diseases give us strategic input into our business decisions.
I love that. And I've only ever seen that done in nonprofits that maybe have advisory councils on certain things, but to put that concept into a like nonprofits aren't in charge of, the actual care. They're in charge of, advocacy and education to some degree. So anyway, I think that's a brilliant. You're very like I just want to talk to you for like 10 more hours. But so
Thank
I
you.
feel like I try to get myself not to talk too much during these, but I'm still working on it. Progress, not perfection. But yeah, you just have a very like big picture mind, which is just, I think, really, and it's inspirational to me. So, um, the rapid fire questions. The first one is, what is your best words of wisdom for someone newly diagnosed with inflammatory arthritis?
Bonnie, you want to go first?
No, you go first.
Okay. I would say, if you're not happy with the first opinion, always get a second opinion. Um,
Mm.
all rheumatologists work a little bit differently. They have different training backgrounds. Some processes might not fit with you. Even though they're the smartest doctor, doesn't mean that that's the best doctor for you because the person just doesn't fit. So find someone that will listen to you and will take everything into consideration and also be open-minded about your care.
Love it. I didn't even know second opinions were possible. I'm such a little rule follower. I'm like, this is your rheumatologist. Okay. you know? So yeah, you have to tell people that. Yeah. What about you, Dr. Vani?
Uh, be the CEO of your own health, take charge, and find your team that gives you what you need when you need it.
Love it. Love it. And what's something that's bringing each of you joy right now? Could be related to remission, could be in regular life.
Both. My 10 grandchildren bring me joy, and every morning I wake up and look at their pictures and
Oh,
imagine the legacy I'm going to leave to them when we are reimagining autoimmune care for them.
that's beautiful. What about you, Dr. Micah?
Yeah, right now gives me joy every day waking up, being able to be pain-free, after suffering for so many years, being able to spread this message to the world and have my passion be my job and not feel like work is work. So eager to every day read articles, scientific articles, be on social media, see patients, living my best life and be able to spend that with my family because 20 years ago, I thought I would be in my 30s, crippled in a wheelchair, in a
Mhm.
cane. But here I am. I'm able to do a lot of intense exercises and work and not be in a cane just yet.
Mhm.
So
Yeah.
very grateful.
Yeah. Well, and I always say this is also partly with one of my internships was in spinal cord rehab. You know, I definitely I know what you mean. If you can, most people's meaningful goal would be to avoid, you know, having to use a wheelchair or cane for mobility. But many people do live beautiful, wonderful lives, very active lives
Yes.
so that's my little soapbox on that.
Yeah, and that's totally okay.
Yeah.
But I'm just happy to be living my best life right now. Be able to
Yeah.
do my job.
Yeah, it's certainly like the future that you envisioned for yourself, like the best
Mhm,
case scenario is what you're able to
mhm.
live, which is totally beautiful. Well, thank you both seriously so much. I'm gonna put you all have a lot of links for social media, so I'm putting them in the show notes just for anyone listening. I always have a full episode page on arthritis.theenthusiasticlife.com. That's my full website, or you can get to it just myarthritislife.net. There's an episode page for each episode that has like full links to all of the things we discussed, the different guidelines, links to Rheumission. But if you want to, what's one social media handle you'd like people to follow you on? Do you think TikTok or Instagram?
Yeah, we can start with Rheumission. Rheumission does have their social media handle. I think it's Rheumission. I have to look it up.
HLTH. Yeah.
Yeah,
Health.
Rheumission Health. Yeah,
Yeah.
Rheumission Health. It's a little bit different on each hand. It's on social media, but it's on Instagram. I think it's Rheumission Health.
Mhm.
And we're on TikTok. We're on YouTube. We're on Instagram, Facebook as well, as also LinkedIn. So we're on 5 channels, and it's
Yay.
on the website as well. And I
Yep.
don't have them all that spelled out at this time.
That's okay. Just, I always imagine someone having their phone out, like while they're listening, like, oh, I want to follow them before I forget. That's like kind of how I do things.
Definitely follow us. We
Yeah.
want to reimagine autoimmune care for every single patient.
Yeah.
It's real, yeah, and it's beyond. I should clarify that. Yeah, it's not just rheumatoid arthritis. So sometimes when people see the rheum, or remission, they think it's just about, from even me, Rheum to Thrive. They think it's only for rheumatoid arthritis, but your mission is really about autoimmune care,
Mhm.
overall. So yeah, I think that's beautiful. Well, thank you both so much. I know you're extremely busy reimagining healthcare for everyone,
Thank you.
and
Thank you so much.
I hope that everyone goes to your website and learns more. And thank you for spending time with me today. We'll talk to you later.
Bye-bye.
Cheryl. Bye bye.
Bye.